Hi, everybody. Our clinical project or DMP group, including myself, Sarah O'Connell, and Nicole Urbaniak, are working on a project to improve dietary knowledge and nutritional confidence by using VR as a simulation. We're working with the Salvation Army site in Virginia, Minnesota. The problem for our project is that many individuals at the Salvation Army site in Virginia, Minnesota have faced food insecurity problems and problems with poor health literacy, creating negative health outcomes. The aim of our project is to improve participants' nutritional confidence and knowledge by at least 50%, measured through pre and post surveys that will be completed on the VR headset. And then the outcomes and benefits of this project, we're aiming to improve dietary knowledge and confidence. And then we also want to understand how VR can promote education and retainment of knowledge too.
Some major themes we found from our literature search include that VR has been shown to be a beneficial tool in promoting learning, engagement, and behavioral change. VR can promote well-being through anxiety and a reduction of social connectedness. Nutritional education interventions in vulnerable populations have been shown to promote motivation for change and healthier diets. And we found that higher nutritional literacy has been associated with healthier eating patterns. The way that we're going to measure our data for our project include pre and post surveys that are going to be completed by participants through the VR headset. They're going to self-record reported knowledge and confidence in nutrition on a Likert scale from 1 to 5. Descriptive stats, paired t-testing, and Wilcoxon signed rank tests are going to be used to analyze pre and post survey results. Total daily Salvation Army users and their age will be tracked to help trend engagement and make sure that we're not discriminating against age or any other populations. And then our goal is that 50% of participants will be reporting higher post-survey scores, and 10% of the population at the Salvation Army we're hoping to participate in our project.
And then this is our implementation plan. We plan to implement on April 29th and go through June 30th, about 2 month span at the Salvation Army site in St. Louis County, Minnesota. The educational focus will cover building healthy recipes, understanding grocery item nutrition, learning more about the role of food in chronic disease prevention. Um, it'll include some hands-on learning. Facilitators will undergo training on April 29th to manage the system, assist participants, track participant attendance, and troubleshoot. And then in order to ensure ethical implementation of the program, all participants will sign an informed consent. They'll be present at the Salvation Army site.